Now my computer just froze. I think my phone, the sound on my phone is still working, but my computer is frozen. Does it look frozen to you?
No,
No. Okay, good.
yeah.
We can hear you just fine. Go for it.
Okay, good. We're just having a lot of computer issues. I think this is a time when I need to wipe everything off my computer and start over again from scratch. Not at this moment, but. All right, so it's a couple minutes after 5. So let's go ahead and start. And I just want to welcome everybody here. It's wonderful to see you all. And we're going to start with a quick reading from Frederick Douglass. Frederick Douglass wrote, those who profess to favor freedom and yet depreciate agitation are people who want crops without plowing the ground. They want rain without thunder and lightning. They want the ocean without the awful roar of its many waters. This struggle may be a moral one, or it may be a physical one, and it may be both moral and physical, but it must be a struggle. Power concedes nothing without a demand. It never did, and it never will. Find out just what any people will quietly submit to, and you have found out the exact measure of injustice and wrong which will be imposed upon them. And those will continue till they are resisted with either words or blows or with both. The limits of tyrants are prescribed by the endurance of those whom they oppress. And that is Frederick Douglass.
Recording in progress.
Okay, did we have any announcements that were going to come at the beginning?
It's all you, Nancy.
Okay, well, it's my pleasure to welcome everyone, excuse me, and especially to introduce our two panelists who we're delighted can join us and are working as a great team here. We have Robin Brown, who is heading up Concerned Citizens Organized Against Lead. And we have Kim Foreman, the Executive Director for Environmental Health Watch in Cleveland. Kim is focused on environmental justice issues and adverse outcomes of environmental exposures, both indoors and outdoors, that disproportionately impact poor and minority communities. So I think Kim is going to start off, so I'll hand it over to Kim Foreman.
Thank you, and thanks for having me. And I've worked with Nancy over the years, so whenever she calls me, I say yes. So thank you.
Thank you, Kim.
I have a long relationship with Robin as well for at least 15 years. Okay. So today I'm just gonna cover at a high level the history of environmental health watch and prevention and advocacy efforts. I'm gonna share some data with you. Our approach to power and policy, as well as systems change work we've been doing recently. The resource center that's developed, was developed as part of the coalition of support and supportive services for landlords and community, and then some contact, and I'll hand it over to Robin. I know we have a short time, so it's going to be kind of higher level, and then definitely entertain any questions you have. So Environmental Health Watch has been around for 40 years, and I've been working in the field for over 20, and the director for about 6 years, going on 7. And so there's a lot of news, a lot of information out there about the Let's Say Cleveland Coalition, but honestly, we've been doing work in the field for many years with the working on a lot of initiatives with partners that have been doing this work. So we have to respect the history of those working on lead, and now there's a new day and more interest. And then I think at this point we have an opportunity to really reduce lead poison in Cleveland. Environmental Health Watch, our core is healthy homes. We also are concerned about a broader sustainable communities approach, and we do more than just lead. We work on asthma, safety. We also work in community around stewardship. We do conferences, we do a big festival in Central Kansas community called Fresh Fest, and looking at our approach to building sustainable communities, which includes a lot of different activities. This is a map of those children who actually get tested and are confirmed at 5 micrograms per deciliter of blood. And this is the latest 2020 map. The CDC just lowered the level of concern to be 3.5. I will not go into the details of what a deciliter means, but we do have research on a Let's Say Cleveland Coalition website that Case has done to and just have put out recently about the 25% of children test positive for lead prior to kindergarten. Cleveland is 4 times higher than the national average, right? And we know that only approximately 35% of our children who are eligible to get tested are getting tested. So for us and for me, screening and tests is important to really get at the real number, because this is only confirmed tests. And if we have a low number of children getting screened or tested, I think we have a lot more work to do to really get at finding out where the children are and then how to target our resources. Right now, we know Glenville, East Cleveland, and Clark Fulton are some of the highest neighborhoods with lead poison, but at the County Board of Health, you could see even in the suburban communities what the numbers are and the levels are, how many children get tested. That data is available on their website. So what I started to look at working with people in the community is that a lot of times folks are angry about what's going on or things not being addressed, but I think that understanding decision-making, who's responsible for what, right? And then understanding what advocacy is, and then how do you use engagement, advocacy, understanding policy, not just programs, to then push for change, right? And taking the lived experience, which is extremely important, and making that valuable, right? So with the policy and power piece that I put together with New Move Foundation at Fred Ward, as we've done several rounds of this. I've done 5 weeks training with folks with Greg Brown from Cleveland State and Policy Bridge we've condensed it to like a 4-hour class, and want to continue to do this type of work, because what happens is those who are already working in their communities, have issues, want to see change, they really need to understand how to navigate these systems. And then no matter what issue you're dealing with, if you understand how decisions are being made, who's responsible, how to build relationships, and the difference between engagement and advocacy, right? Even down to voting and the power of voting, right? Oftentimes we tell people, go vote, but we don't give them a why or reason, right? Or how do you get results? And it's a long-term strategy and relationship building strategy. Even with the folks that I've touched over years, I think it's important that we build relationship with people and work with community, not for them, and do things for them, right? And they have a lot of capacity and they teach us a lot as well. But this was a thing that I really am committed to. And starting here versus, are you interested in lead? Yes, it's important, but do you understand what building a house is supposed to do? Do you understand what community development does? Do you understand the health department? And then who's there? You know, they care too. They're coming out on Saturday. Some of them have children who are lead poisoned, but oftentimes the residents don't get to connect with the folks on the inside, those who are responsible for some of pushing the legislation or making sure homes are safe as well. But there's a division of responsibility too, right? Everybody has to be part of this and connected to it. It's not point the fingers one entity over the other. That's why the power of the coalition is so strong. It's a public-private partnership. So if you don't know, you know now that we got this attention and headlines and the news and all that. We are not done, right? A lot of what we were working towards, 99.4 million over 5 years with all hands on deck, was to cover approximately 25,000 units. You know what I'm saying? We based it on some theories. We based it on some research from Case. We have 100,000 units in Cleveland. We are not looking to abate the units. We're looking to make them lead safe, and landlords have to comply with the new law. We have a rollout, it's feasible, it's mitigation strategies that we've researched over decades that we are applying to lead safe, because we've done the research and know that's at least the minimal standard to make a home lead safe and to manage it every 2 years. So the compliance that landlords have to comply every 2 years is based on our protocols as risk assessors, right? So we tried to make this practical, but something else needs to be done, and it's a housing issue, and this is a systematic approach to a housing issue to deal with lead poisoning, and it's also based off of understanding what folks did in Rochester by reducing their lead poison rates by 85%, and we know we have a rich data. We have rich data. We have a lot of data. We have a lot of partners. We have all these health systems. So the political will was really the thing. And we have a ton of funders at the table now, right? So those are things that make the synergy go and make this a lot bigger, and really we can actually get it done. So part of the loan fund that's developed that you might hear about, we have 2 sides to that. We have 2 administrators. Environmental Health Watch administrates the Lead Safe Resource Center, and Cleveland Housing Network administrates the loans and grants that go to landlords. If they need loans and grants, they go to Cleveland Housing Network. We have workforce, right? We have lead 101 education. We have compliance and certification, navigation, education, and dedicated staff person. We have a call center. And so all of this is operating as part of a new system to support, what landlords have to do to support the awareness building across the community and to make sure that people have access, right? And we have a team of folks out in the community outreach team out every day based on a rollout. And so they're developing more outreach plans, right? And building their capacity to grow that. So we were established in 2020 during the pandemic, and we started workforce in 2020, because we needed to build capacity on the ground. So we have access list of third-party professionals that landlords can call, people can call, and they've been vetted by us to address the lead hazards and clear properties. And also Cleveland Housing Network has their own contractors because they manage all of the work if a landlord needs to get access to loans and grants. We also give landlords a $500 reimbursement if they're doing it themselves. They come to class for free. They get a reimbursement if they show a state certification, $1,500 per zip code per landlord. This is just to show that we're out. We're at different events. They're out doing the door knocking, business drops, and connecting with other organizations to expand the reach in the community. And so here's a resource. The website, it needs to be reworked to be a little more user-friendly, but when we first started, like everybody wanted to figure out what all should we put on there. We gotta let people, it's just a lot getting started. Now we're making a shift. We're going into year 3, and we know some things now. When we started, it was just theory, and we applied some of the research that we already knew about the technical aspects of the work. But a lot of this is new for everybody. That's on the left side. On the right side, I worked on a project called the Build Health Challenge, and a product of that was this app that you could go in to cleveland.housing.health, put in an address, and you can see if the house is registered with building and housing. Soon you'll be able to see if the house has a certification. It also shows you if the house has violations and the risk. Like if it's built before 1978, it's not a place to look for a rental unit, but you could plug in addresses if you're interested. You can compare different addresses on this app. So this is kind of one of the things that led up to the coalition of Build Health Challenge. We worked on it for 4 years and built this relationship with building a housing and stuff. So these are just some things as far as putting more power in people's hands and making sure that we start to elevate a lot of these things. And it takes all of us to teach and talk and point people into the right direction. So I don't know how long that was. I didn't see Robin waving her hand, so I'm gonna pass it over to Robin. And let me know, Robin, where you need me to advance your slides. So these are our contacts, and oops, my email is kim@ehw.org. I forgot to change it, but I will change it. And you could pull up the new slides if you share them. Thank you.
Thank you, Kim, for sharing the information that you just did. And I am Robin Brown. I am the founder of Concerned Citizens Organized Against Lead, better known as CECO. They're a environmental justice strategist consultant. I'm going to be speaking from a family perspective today with you guys. You heard what Kim is doing on her end and what my experience and my own experience of my daughter being poisoned over 23 years ago. Our struggle started when we had to be in the hospital and her lead level was at a 70 micrograms per deciliter. If you heard Kim speak about 3.5 as a level of concern, and no level is safe for any child, but my daughter was at a death seizure coma level when we was introduced to lead poisoning, and she was at the age of 4. During the 5-day stay of her hospital stay, she had to receive chelation therapy. Chelation therapy is not a way to basically treat lead, but it's a way to help remove the lead from the bloodstream when it's at an emergency state. And it consists of every 4 hours of a shot given, and that takes 30 minutes to administer, and that shot is done for 5 days. Out of that space, I was not made aware really of lead poisoning, what it was. Her private physician didn't show up. It made me start asking questions. What about the other families? And that's what got us started with our journey. We had to fight really hard to learn about what lead poisoning was and what we had to do for our family. And it was through the grace of God, another parent sharing and assisting me. Her name was Kim Fueling, and she started with Apple. With that organization, I got involved being their president and chair and start doing community outreach and helping other families move around the space of lead poisoning. Next slide, Kim. You could go to next. Go back one more. Go back one. Okay. For me, I've been living in the Mount Pleasant area. That's the area that my daughter became poisoned in. We have been living in the same area for over 30 years now. For me, my passion is because we have 4 generations of families within my family, starting with my 57-year-old cousin, my daughter that is now 28. I have a 14-year-old great niece, her brother, which is now 8, and then we have a 1-year-old. So for me, my family alone, we have 4 generations of individuals who is afflicted by lead poisoning. So I'm vetted for that reason, as well as Lead is one of the things that's not prejudice, but it does hit Black and Brown communities more. And I'm vetted in it because I am a Black and Brown person. And I know the devastation that is hitting our communities with redlining and other things that's going on, how we have to fight a little bit harder in our spaces to get proper care. Helping families is our lifelong lesson. This lead poisoning just didn't hit and hurt my daughter. It hurt our whole family. It was a process for me and dad, as well as her older siblings. It was a hard effect towards all of us. My 14-year-old at the time was sort of neglected because I spent 5 days in the hospital with my youngest daughter. And because she was 14, I felt she could handle some of the situations around the house better than my youngest daughter. And so I kind of neglected her, not purposely, but ultimately she informed me how she missed me during her time of need when I was focusing on my 5-year-old. So as a single mom, it was hard to navigate this space. It wasn't anything easy. I worry about her today. We still have effects which hers didn't show until she became a teenager. And that's when we start seeing her effects of lead. So the latent effects of lead is very important to know that it occurs, because it's not just when the child is 0 to 6. We have to be concerned from that child's age 7 and to the day that they're no longer here with us. Next slide, Kim. So what CECO has been doing in our organization, we have been able to date to help over 178,000 individuals from the time of our existence. It came from in-person education, community outreach efforts, our community conversations at clinics, daycare centers. We were partners with Starting Point and did outreach to all of their sites and their families. We also had opportunity for media platforms, radio stations, podcasts. So a combination of all of those spaces, we have been able to reach 178,000 people, educating them. And one of the unique things about CECO, it is led by afflicted people. It's led by the people who is afflicted by lead poisoning. And they come up with the programs and the solutions to this problem. And that's one of our niches, is that people can trust us. The relationship building is there. We can relate to one another, and that peer-to-peer support is fantastic, because you feel like you're alone in this space. And we feel guilty a lot as those parents. It's like it's our fault that we couldn't help our child, but the guilt isn't our fault. And to help other parents navigate through that space is really important, because it's not our fault. It is our society, is our environment. Lead is preventable, and our kids don't have to be poisoned today. Next slide. Like I spoke about, a lot of times people don't understand that the effects of lead doesn't always show when children are ages 1 to 6. A lot of times we see them afterwards. The young lady on the left is my daughter at her younger ages. And the gentleman on the right is my great nephew that I spoke about, Jackson, and he's 7. My daughter and him had 2 different symptoms. She was more milder. My Jackson actually had to be removed from his home because they thought he was being, domestic violence was occurring, but it wasn't. It was him actually banging his own head up against the wall. He would climb on the cabinet and jump off of the cabinet. We even found him on top of the refrigerator, and he jumps off the refrigerator. Jackson is not the only child. I have a friend that's in Elyria that went through the same space where her son was removed from their present as well. And that's traumatizing to the family. The child doesn't know and realize what they're doing, and how, you know, their behavior is causing them to be removed from home. And at the same token, the parents is trying to protect their children, and they were being held as the culprit to the damages that was occurring. But due to the aggressiveness that they had, they were actually doing things to themselves. And so both families now have their children at home through the grace of God, but it's something that we have to go through, and still elevate this space to let it be known. These are some of the symptoms that do occur to the children. Every child is different. No child have the same symptoms. Each one is different. How it affects them is different. So it's important to get that lead screening done, that you will hear me talking about and Kim spoke about a little bit. Is very important, because the only way to know our children is lead poisoned is by a lead screening. And if that screening is not being done, then we missed the beat on some of our diagnosed symptoms. It could be looked at as other things opposed to lead poisoning, because it mimic other symptoms. Next. And living with lead on a daily basis. Again, we have children that is not able to help manage it because we have food deserts in our community. Diets are very important to lower the level of lead in a child's body. And without proper foods and healthy foods in our communities, it hinders removing lead from the body. Our schools, you know, we have to get lead more advanced in our school. That lead poisoning and the symptoms of children, which is loss of IQ points, behavior issues, are some of the things that are delaying our children from learning. With COVID-19, our testing rates have declined even more so. We have a federal law that all Medicaid kids are supposed to be tested automatically. And that law has not been adhered to for decades. But we need to make that law and ask that our physicians test our children that is on Medicaid. But honestly, my opinion is all children should be tested for lead poisoning, no matter if you're on private insurance or Medicaid during the ages of 0 to 6. Our state in Ohio, our lead level is really high. In Cleveland, we're as bad, 4 times as bad as Flint, Michigan. And so therefore, we have very much so every concern to get our children tested, because again, that's the only way to know that a child is poisoned. Next slide, Kim. And what are our families doing? These are my 2 beautiful daughters with me. My left is my youngest, the one that's afflicted with lead. Through the grace of God, by proper management, getting the research and history about lead, ensuring to put back what lead causes a child to lose, I was determined to put back as much as I could physically into my daughter. With early education, we would walk down the street and I would have her look at the houses and tell me what color she sees. We would count the sidewalk blocks. We would count the trees. Anything that would do mental stimulation was what we were doing in reference to calcium and iron, making sure that she had the proper supplements within her system, eating healthy, staying away from fatty foods, which help lead absorbed within the body. Fatty foods help with that, as well as keeping her away from sugar. She was actually addicted to sugar. Lead is sweet. And to this day, she tells me she has a craving of that chalky, pasty taste. And the only way she can meet that need is by buying the dipstick candy, which has that powder and a little chalky stick in it. That's what she used to crave that craving. And if she didn't know about lead poisoning, she said she would be seeking it out. So I'm grateful for her education, but it was also important to educate others. She actually graduated from Kent State with her bachelor's degree in 3 years. She graduated from high school in 3 years, taking High Tech Academy at college. So she did high school courses along with college courses, and able to graduate in 3 years with criminology as her major and sociology as her minor. And what can you do to help our families from the local state level? Commit from medical, mental, and other various entities that work close to families affected by lead poisoning. We need a better relationship. We need to be partners and not just patients. Parents are the last ones told what will happen next to our children. Where with that partnership, we should be working on the issues and the pace together. Mandate results and resources to be given to the parents within explanations of what that results mean. A lot of times parents don't even know to get the number reading from the lead test. So you're hearing us call out numbers 70, 3.5. That's the measurement of lead in the blood system. So that number is what's important, not negative and positive. We need to know that number. That helps us know how to manage it. Parents are not told about the development programs or availability. Sometimes we're not told that we should have a behavioral evaluation as well as a cognitive evaluation on our children when we're younger. Next slide, Kim. We also can help families if we're able to request and receive risk assessments between 9 and 5. A lot of activity doesn't happen outside of being made aware that of the concern and given information, but maybe we need to have more of a risk assessment for those children. We need to create a budget for community outreach and education conducted by lead poison victims. We found that the relationship building and the peer-to-peer support has really been a niche for families in reference to being able to deal with each other. We also would like to take more third-party surveys on the services that the parents receive from hospitals, social services, health departments, other remedial service and investigations, case management and engagements. And then other resources that you could get from a family perspective is listed here as well. Other links you could go to see other articles and different things that happen during pregnancy and lactation period of someone who's been poisoned by lead. My grandson, it was a fear of mine when my youngest became pregnant because of her high level of lead. Lead stores in the bones 90% what was in the blood. So during her pregnancy, you know, there's still fear of the fetus being affected from her being poisoned at such a high level.
Robin,
So-
I hate to cut you off, but yeah, if we could get to that
Thank
last
you.
slide there. Thank you.
Thank you, and our contact information. Thank you.
All right. So for those of you who are new to connecting the dots, our goal here is to get you into action right away. So there have been some actions suggested here, and I'm actually going to put into the chat. We have a link with a bunch of resources. What you've seen on the slide, many of the things that Kim and Robin have talked about are listed there. And then there are 4 actions that you can choose from to get started on right now at this minute. So I challenge you to at least take one action, and I have 4 of them listed here. One is to sign up for the newsletters from Environmental Health Watch, I believe that is supposed to be. I typed that in incorrectly, sorry. The link is there to sign up and follow them on Facebook. So that's number 1. Number 2, join the Lead Safe Cleveland Coalition, which you can do by sending an email to info@leadsafecle.org. So you can send an email there and sign up for that, especially if you're in the Cleveland area and want to get involved. This is a great action for you to take. You can also call the Lead Safe Resource Center, and the number is there, 833-601-5323. And then you can contact your representatives in the state of Ohio at the state legislature at the House to say, hey, we need childhood lead poisoning screening for all children, and ensure that the current federal law for Medicaid children due to receive screening tests is implemented. We need to demand this at the state level, that this happens. The link there is to take you to find your representatives at the House. You can send a letter, you can make a phone call, tweet, Facebook, everything, do it all and contact them. So that's your 4th option for your action today. So I challenge you now to choose one and do it in the next 20 minutes before we get off this call today. While you are taking action, you are welcome to either put into the chat or unmute yourself and ask any questions of Robin and Kim while they are here to answer any questions that you have on taking action and moving forward. And I will say, for that letter to the House representatives, there is a long list of bullet points, those last 2 slides that Robin was talking about. All those bullet points are in the Padlet for you, so you can pull from that to create your letter. So, questions, the line is open for anyone who would like to ask questions of Kim and Robin. And thank you, Kim and Robin, for such a heartfelt and informative conversation with us today. Really appreciate it. And they're all getting into action now. Go for it. Take your actions. Do your thing. And I'm going to take myself off of Spotlight. Actually, I'm going to put both of you on Spotlight so we can see you. So I have a question then, and nobody else has one. In my local area, which is the Dayton area of Ohio, what can I do in my area are there lead levels that we need to look for here? What can I do in my local area to make a difference?
I'll say one thing, and then Robin, I know you work with the state advocacy group. So I would say, if you have a house built before 1978, you have a health department, there could be some HUD program dollars to assist you, but people who are concerned really need to be connected with their health department first, right? Because they could have resources, any housing focus supports to get things fixed. And the state does have some resources, but those are probably harder to navigate. It's easier to go, to your local health department. But if you live in a house built before 1978, there's some basic things we can do, but we also want to make sure that the government, any landlords, do what they're supposed to do to the actual structure. What we don't want to do is put the responsibility all on the parents to clean up their home. And really, if their rent is the landlord's responsibility, but they can work together, then I'll pass it over to Robin. Oh, you're on mute,
muted, Robin.
Thank you. You could join Ohio Lead Free Kids Coalition. That is a statewide organization that is open for all people that is interested around this space, like to know more about this space, work towards this space. You get real great resources because it's people from all over the state that is in that place. So that is a great way. And then always you can look at Ohio Department of Health website and go to their data and look up some of their data to see about your neighborhood and how many kids have been tested and different things of that nature. So ODH is always available.
Thank you.
I'll ask a question. I know both of your organizations are nonprofits and probably always in need of funding. What is the best avenue for donating, and are there particular projects that you mentioned, Robin, some in years of things you're hoping to do with outreach with lead poison victims and so on. So tell us a little more about how for both of your organizations, donations can be made and used.
Well, donations could be made out to concerned citizens organized against lead. We have a couple of programs that we're doing. One of our most recent ones, and we're really proud with, is the Clean Water Lead Free program, which is when we were raising funds to give out water filter systems to put on people's water faucets. So we're raising funds to continue that with the lead issue, which we'll be talking more next month with the lead service lines. So you'll hear more about that next month. We also raise funds to help with our education, our printing materials, our brochures, to help pay stipends for people who do the work. That is volunteers of our membership.
Yeah, and on our end, Environmental Health Watch, I just want to be clear, right? We have to do a better job of building our donor base for Environmental Health Watch, the organization, because we do more than just lead work, right? So you hear about money, that's really like a lot of money is going out the door under the Lead Safe Resource Center, but we're connected to Network for Good. You can go to our website and donate, but we are looking forward to build our donor base, and we'll be focused on that over the next year. That's how does EHW, right, build, because we don't want to be overtaken by the Lead Resource Center, the coalition, because we still got other stuff to build and build our capacity as Environmental Health Watch. But definitely people, resources, information, I think is always needed too, not just money, but you know, especially joining efforts and advocating for, definitely, I feel like it's a space for parents to start to build that participation with parents, working, you know, on the Robin side of things. We need their more of their voices in there.
Thank you. Other questions?
What are the things that the landlords would need to do? What are some of the things that they would have to do to fix the problems?
Well, on our website, we have like a 6-step process. So what we did was say, you don't have to get a pre-assessment. You can assume if the house is built before 1978, you can assume there's lead there somewhere. Check your property. Then you decide, am I do it yourself or do I need loans and grants? Do it yourself, you have to get a renovation, repair, and painting certification in order to work on your own property. That's been a federal law for decades. So we provide that training. And then you have to either do it yourself, clean up property properly, and then hire a third-party clearance person, clearance tech, or risk assessor to check the property. After the property is checked, they get the results. They'll submit the report to Building and Housing. Building and Housing actually gives you the certification, right? And this is internal controls, which means painting, keeping the paint intact, which you should already be doing. We're just really getting them to kind of clean up the lead dust, right? Make sure there's no hazards around the house. Make sure there's no chipping and peeling paint. Make sure you don't have wood falling apart or leaks and stuff like that. A lot of this is really practical. It's just a practical approach to making a property safer and maintained. And then the cleaning is probably something a little extra, right? And having that clearance done is ensure that you cleaned up properly. And then that's good for 2 years. The renovation, repair, and painting certificate is good for 5 years, right? So if I'm a landlord and I want to work my own property, I only have to get that again in 5 years, right? The certification is good for 2 years. Loans and grants, you go to Cleveland Housing Network, they'll look at your criteria and they manage all the construction. And then you take that risk assessment or clearance and take it to building and housing. So building and housing is the authority that then issues the certification. The coalition and all of us are community led. We are not enforcing the policy. Building and housing is.
Thank you. And I just put into the chat, share your actions in the chat. Let's let Kim and Robin know what you're taking action on today. So if you want to put them into the chat, please do share. Any other questions? Just a few minutes left here. Okay. Well, Robin and Kim, thank you so much for being here and for sharing your information and for answering our questions and giving us some great actions to move forward on. We really appreciate your help with that. Is somebody trying to talk or? Okay, wasn't sure. I know I'm going to be signing up for the EWH. I'm not up in the Cleveland area, but I'm still going to sign up to keep tabs on it and see what they follow it and share with people that I do know in Cleveland, because I know a lot of people up there and I have family up there as well. So definitely going to be doing that. I didn't put it in the chat, but I'm saying it live here right now and recorded. So we appreciate you being here. Connecting the dots is all about connecting the dots of all the different intersections of people, planet, and power. And you've heard Kim and Robin share about the people who are impacted in this state, how the environment is impacting them, and the power that we have as citizens of this state to do this. And this can be done in any state. This is not just an Ohio thing. I just had a friend who literally had to do lead abatement in her house in Chicago over the last week. They had to move out of their house for the last week, and it took longer than they expected. And their son has had symptoms and they've had to do treatment. So this is not just an Ohio thing. This is something you can share with people across the country as well as in our state. So please keep that in mind as you know people in other states who live in homes that were built before 1978 as well. So thank you very much for your time. I do want to mention that we are doing part 2 of this conversation next month on the 27th of March. Robin will be coming back and we'll have Crystal joining her next month. And that will be at the same time, 5 p.m. And we should be putting the link into the chat for you to register for next month's call so that you can do that. And then if you are interested, every week we meet, and you don't have to come every week, but we do appreciate the help. Every week we have a leaders meeting that meets to plan these events. So we're the ones who connected with Robin and Kim to bring them here. We take care of the Zoom. We're the ones who send out the emails. We do all of that work. These things cannot happen without volunteers behind the scenes pulling these events together each month. So if you are interested in joining the leadership team, I highly recommend that you send an email to uujoenvironmentaljustice@gmail.com so that you can join our team. If you would like to continue to get emails about what we are doing and what our events are and what you're going to see here each month and want to know what next month's event is and get email notifications, please sign up for our Google group, which you can do by sending an email, which will be posted into the chat momentarily. You can just send a blank email to that. It will automatically subscribe you and you'll be in our Google group to get updates. And just a reminder that we do have Padlet, which we have shared with you today, which has all the resources in it that will be available after this meeting. So you can go ahead in the Padlet and look at the resources. It'll help you write letters, have conversations, lots of research available. Thank you, Kim and Robin, for putting that research list together so you can learn more and continue to read. So we thank you for all of that. Please do join us next month. And I just want to put a call out that if you have an event that you'd like to bring to our group, if you have a topic you want to see us bring to you that's environmental justice related, people, planet, power, we would love to have those suggestions. You're welcome to put those into the chat for us and let us know what those topics might be. And if you know a group or a speaker who could come and help us explore that topic, we love those suggestions as well. So please help us grow this. We have been in existence since July of last year, August of last year, and we're continuing to grow our database of people that we can call on, like Robin and Kim, to come and help us understand these issues that we may or may not know as much about. We all walk away with something every single time. So please let us know in the chat if you have additional topics or suggestions for us to look into, people who can speak. We'd appreciate that, especially if you have a burning one that you want to see in April. We'd love to invite you to come in April and join us and speak on your topic, whatever that is, environmental justice related. All right, and without further ado, I'm going to close us out with a quote. I hope you're continuing your actions, and thank you again for being here today. I'm going to close us out with a quote from Jane Goodall. You cannot get through a single day without having an impact on the world around you. What you do makes a difference, and you have to decide what kind of difference you want to make. Thank you for making a difference and being here today.